Various side effects can happen when misused anabolic steroids, varying from mild impacts to harmful or even life-threatening ones. Most are reversible if the user quits taking the drugs. However, others can be permanent or semi-permanent. Before we start, don't forget to subscribe to our channel and hit the notification bell to get more informative videos. Okay, let's see the adverse effects of misused anabolic steroids. Stay tuned to parshealthtv. Number 6. Effects on hormonal system. Steroid use disrupts the regular production of hormones in your body. Changes that can be reversed are reduced sperm production and reduced function of the testes, hypogonadism, which leads to low testosterone levels and shrinking testicles, testicular atrophy. Irreversible changes are male pattern baldness and breast development or gynecomastia in men. Anabolic steroids can also act upon the hormone system to raise the risk of testicular cancer, mainly when steroids are used in combination with insulin-like growth elements. In females, anabolic steroids generate masculinization, especially breast size and body fat reduction. The skin becomes coarse, and the voice deepens. Women may also experience excessive growth of body hair but lose scalp hair. With continuous administration of steroids, some of these consequences become irreversible. Generally, anabolic steroids will have irreversible enlargement of the clitoris in females. However, there are no studies on this. Number 5. Infections. Many people who inject anabolic steroids may utilize non-sterile injection methods or share contaminated needles with other users. This puts these steroid users at more risk for catching life-threatening viral infections, such as HIV and hepatitis B and C. Also, animal models show that anabolic steroids suppress the immune system, which could worsen conditions. Number 4. Musculoskeletal system. Rising testosterone levels and other sex hormones typically trigger the growth spurt during puberty and adolescence. These boosted levels of testosterone also provide the signals to stop growth. When a kid or adolescent takes anabolic steroids, artificially high sex hormone levels can prematurely signal the bones to prevent their growth. Evidence indicates that weightlifters who misuse anabolic steroids have stiffer tendons, leading to an increased risk for tendon injury. Number 3. Liver. Steroid misuse has been linked with liver damage, tumors, and a rare disease called peliosis hepatis, in which blood-filled cysts are made in the liver. The cysts can rupture, generating internal bleeding and even death in rare patients. Number 2. Skin. Steroid misuse can also cause skin acne, cysts, hair loss on the head, and oily hair and skin. Users who inject steroids may also have pain and abscess formation in injection areas. Anabolic steroids can also cause jaundice or yellowing of the skin or eyes as a result of damage to liver damage. Number 1. Cardiovascular system. Steroid usage has been linked with high blood pressure, lowered function of the heart's ventricles, and cardiovascular disorders like heart attacks, artery damage, and strokes, even in athletes younger than 30. Steroids contribute partly to the development of cardiovascular disease by raising the level of low-density lipoprotein, LDL, and lowering the level of high-density lipoprotein, HDL. High LDL and low HDL levels boost the risk of atherosclerosis, a disease in which fatty substances are deposited inside arteries and disrupt blood circulation. If blood is prevented from reaching the brain or heart, the consequence can be a heart attack or stroke, respectively. Steroids also raise the risk that blood clots will develop in blood vessels, potentially disrupting blood flow and damaging the heart muscle so that it cannot pump blood effectively. What are steroids? Steroids, sometimes called roids or juice, are the same as, or equal to, specific hormones in the body. The body creates steroids naturally to sustain such functions as fighting stress and stimulating growth and development. But some people utilize steroid pills, creams, gels, or injections because they think steroids can enhance their sports performance or the way they look. Anabolic steroids are artificially made hormones that are the same as, or similar to, androgens, the male-type sex hormones in the body. There are more than 110 variations of anabolic steroids. The most potent androgen is testosterone. Although testosterone is primarily a mature male hormone, girls' bodies have smaller amounts. Testosterone aids build muscle and promote the manly traits that guys develop during puberty, like deepening the voice and growth of body hair. Testosterone levels can also impact how aggressive a person is. Athletes sometimes take anabolic steroids because of their testosterone-like results. Other steroids, sometimes called steroidal supplements, have dihydroepiandrosterone, DHEA, and androstenedione, also called andro. For the most part, steroidal supplements utilized to be seen at health food stores or gyms are now banned and need a prescription. DHEA is one of the few exceptions and can still be purchased over the counter. Steroid supplements are weaker forms of androgen. Their influences aren't well known, but it's thought that they cause effects similar to other androgens like testosterone when taken in large doses. But research studies indicate that they do very little or nothing to enhance athletic performance. Companies that produce them utilize false claims, and very little is known about the long-term consequences some of these substances have on the body. That's one reason the government acted to protect citizens by passing laws controlling steroid distribution. How do anabolic steroids work? Anabolic steroids promote muscle tissue to grow and bulk up in reaction to training by mimicking the impact of naturally created testosterone on the body. Anabolic steroids can stay in the body anywhere from several days to about a year. Steroids have become widespread because they may enhance endurance, strength, and muscle mass. Yet, research has not revealed that steroids improve agility, skill, or athletic performance. Most data on humans' long-term results from anabolic steroids come from case reports rather than formal epidemiological examinations. Severe and life-threatening negative effects may be underreported, mainly since they may occur many years later. One review discovered 20 deaths in published case reports associated with anabolic steroid usage between 1990 and 2012. However, many steroid users also had other drugs, making it difficult to show that the anabolic steroid use caused these deaths. One animal study discovered that exposing male mice for 1/6 of their lifespan to steroid doses comparable to those taken by human athletes caused early deaths. If you enjoy the video, don't forget to like it and share it with your friends. Thank you for tuning in. Have a great day.